What if stroke swallowing assessment equipment is not available? Imagine you're in a hospital where specialized tools like videofluoroscopic swallowing studies or fiber optic endoscopic evaluations are not accessible. What do clinicians do to assess if a stroke patient can swallow safely? The answer lies in careful, structured bedside assessments that rely on clinical judgment and simple tests. These assessments are vital because swallowing problems after a stroke are common and can lead to serious issues like aspiration pneumonia, if not identified early. One of the main approaches is using standardized bedside screening tools. These are simple tests that do not need fancy equipment but have been validated through research. For example, the water swallowing test involves giving small amounts of water to the patient and observing for signs like coughing, throat clearing, or a wet voice. If the patient shows these signs, it suggests they might be at risk of swallowing difficulties. The volume viscosity swallow test is a bit more detailed. It involves giving different volumes and thicknesses of liquids and watching for signs of aspiration or difficulty. The gugging swallowing screen is another useful tool that assesses not only swallowing safety but also saliva management and awareness, helping to determine if the patient can handle oral feeding or needs alternative nutrition. In addition to these tools, clinicians perform a thorough clinical evaluation. This includes reviewing the patient's medical history, examining their oral motor function, and observing them swallow various foods and liquids. They look for signs like coughing during swallowing, a wet or gurgly voice afterward, or oxygen level drops, all of which can indicate a risk of aspiration. Based on these observations, clinicians can decide whether to proceed with feeding, modify the diet to safer textures like pureed foods or thickened liquids, or temporarily keep the patient nil by mouth. When specialized equipment isn't available, safety becomes the top priority. Starting with small sips of thickened liquids under supervision can reduce the risk of choking. If there's any doubt about swallowing safety, healthcare providers may choose to provide nutrition through alternative routes such as intravenous fluids or feeding tubes until the patient can swallow safely. Close monitoring is essential, especially for signs of silent aspiration, which occurs without coughing and can be missed without instrumental testing. If and when more advanced assessments become available later, they can help refine the diagnosis and guide therapy more precisely. Multidisciplinary teams, including speech-language pathologists, play a crucial role in ongoing assessment and rehabilitation, ensuring the patient recovers as safely and quickly as possible. It's important to remember that bedside assessments, while valuable, are not perfect. They can sometimes miss silent aspiration, so clinical judgment and vigilant observation are key. Instrumental tests like videofluoroscopy or fiber optic endoscopy remains the gold standard because they provide detailed information about how swallowing works. But in situations where these tools are not accessible, well-trained clinicians can still make informed decisions using validated bedside assessments. Always consult healthcare professionals for personalized advice, as each patient's situation is unique. The goal is to keep patients safe, prevent complications, and support their recovery through careful, evidence-based practices.